Welcome to today's meeting of Dundee IJB. Can everyone who's online hear me okay? Yeah, that's good. We've actually moved a bit closer to the screen, so hopefully it should be fine. We have two new members here today. Firstly, it's directly opposite me is Kate Geary, who's the newly appointed Director of Public Health, just in post for 4 weeks. So yeah, welcome to Tayside and particularly welcome to Dundee IJB. Good to have you here. We also have new carers rep, carer himself, who should say, Nicola. Nicola brings a wealth of skills, knowledge and experience to the IJB, having used health and social care services in Dundee, both herself and as an unpaid carer supporting family members. Nicola is also a member of the NHS Tayside Public Partner Network, having joined following her retirement from NHS Tayside, where she worked closely with colleagues across the health and social care partnership supporting primary care services. So we're really pleased to have you here. We came to have a new service user rep for some time. Glad to see you here.
Thank you so much.
Okay, you are.
Thanks. Can I just take this opportunity to remind everybody that the meeting is being recorded? I'll now take a roll call for the minute. Councillor Blake. Bob Benson.
Present.
But apologies from Councillor Toland, but Councillor Short is here on our behalf.
Morning.
Councillor McHugh.
Present.
David Cheek.
Present.
Pauline Carlton.
Present. Morning.
Lynn Lloyd.
Present.
Dave Berry.
Present.
Christine Jones.
Present.
David Wilson. Jane Smith.
Present.
Sanjay Pillai. Raymond Marshall.
Present, thank you.
Jim McFarlane. Christina Cooper.
Present.
Nicola Stevens.
Present.
But apologies from Martin Sloan. Kate Geary. David Shaw.
Present.
And that concludes the roll call. Chair will just carry on.
Yeah, please.
Okay, item 1, apologies, they're already noted. Item 2, declaration of interest. Are there any declarations? Not seeing any declarations, so that takes us on to item 3, which is the minute of the previous meeting held on the 10th of December, which is submitted for approval, and the action tracker.
I'll just put the book released page by page. If anyone has any comments or if there are any inaccuracies, Joyce, I noticed can't get sound. I wonder if you might try restarting your Teams or maybe even your computer, Joyce. That might hopefully work. I'll continue with the minutes at this point. That's what page 1, page 2, page 3. Page 4, page 5, page 6, and page 7. Great, happy to agree those.
There's one or two things in a minute that I think should probably appear on the action tracker. But I'm happy to point that out to whoever out with the meeting.
Go on to the action tracker as well, maybe that point, John.
Sorry,
If you come to the action tracker, you could just next item. So
but these are actions from the last meeting that don't appear on the action tracker.
that's it. It would be appropriate to maybe suggest something, wasn't it?
Okay, on page 5. Primary care mental health and wellbeing framework, there's an action in the last item, and that is an action. Additional information to be provided to Bob Benson I think that should probably go in the action tracker. She did or she did not.
Catherine, do you want to explain what we agreed about what would appear and what wouldn't?
Yeah, so there was a discussion about things that are with the action tracker, but quite often when people ask for updates about things for individual members, so extra information. So they are noted and Aaron gives us a list of the management team separately to follow up on. You track that through the management team meeting, just in terms of taking on board the comments from members about the length of the action tracker that are coming from now. So we try to put the split those information ones and track them separately.
That's fine. There's something that says that's. Yeah. Okay. One other thing that we have is page 6. Financial monitoring position as at October 2025. Information could be sent to council and review on the rates with supplementary staffing. I don't think I've let that up. And it wasn't the rates, it was the costs compared to standard staffing costs. Asked about, what is the supplement?
Excess costs.
Yeah.
That's what it's about. So, I'll be in one, so it's even one. The obligation. Thank you.
The next section is the action tracker.
Anything on the action tracker that I want to ask about, comment on? Usually we get through the action tracker without any action. Okay, thanks for that.
Item 4, membership of Dundee City Health and Social Care Integration Joint Board Service User Representative, and the Integration Joint Board is asked to agree the appointment.
We're happy to agree this.
Yes, indeed.
I think it's at this point, actually, that. But. You're very welcome. Next item, please.
It's item 5, Performance and Audit Committee Chair's Assurance Report, and it's submitted for information and record purposes.
Any comments, questions on this?
Chair, can I ask a question on the first page where it talks about the cocaine
Yes.
cocaine use and including training for staff to deliver interventions? I think also it kind of queried whether it would be good to explore what was happening a bit further, so that we're all aware, and just whether that should stay at the path, or is that something that would come to the actual IJB?
Sorry, who was this one, please? Oh, yeah,
From alcohol substance indicators.
yeah, any council election?
So, yeah, just I can get that. Yeah, so I think what we could do with such items, we could put that, we continue to put that through the part that what I need to be escalated forward to the IJB for consideration to take that the further report. Obviously we're going to tie into the recruits as well.
Yeah. Okay, thanks.
Okay, next item, please.
Item 6, Strategic Commissioning Framework 2023 to 2033. It's statutory review, and you have this for a decision.
Okay, so I think this is something we need to do it for 3 years, unless we refer to the wrong people. That's right. I don't know, Catherine's going to speak to it.
We are required to complete a statutory review of the IJB strategic plan every 3 years. So the strategic plan advisory group have been working hard over the last year to go through that process. The report gives quite a bit of detail about what that process has looked like, and there's been previous reports to the board around that, and it falls on terms of the approach we've used in previous years around that as well. So the report today is to conclude the review process by making a recommendation to the board that we retain and in some specific aspects revise the current IJB strategic commissioning framework. That would conclude the statutory review process, and if you do agree that, we would move into the process of making those revisions and bringing those back to you towards the summer. So probably some key bits in terms of the report and the process, as always, just to draw your attention to the element of the process around engagement in section 4.2 and the appendix that's attached to that. Joyce Barclay was on the call and Caitlin Robertson led the process around engagement with members of the public and with our workforce to inform the review process. I think that was really interesting, actually, and probably mirrored some of the information that we had from last year's budget consultation. So some of the key themes from that were around the importance of all 6 strategic priorities. So it's very clear from that engagement that people felt that all 6 of the current priorities remain very much in focus in terms of health and social care needs in the city. Where people were maybe asked to, if you had to prioritise a couple of those, what would those be? The focus fell in most groups to the inequalities priority and the one around workforce. What's the kind of specific key concerns around access to services, etc., that are outlined in the report, but all of those are really quite well aligned to existing content within the strategic framework. And I think the other thing just to highlight, and again, it mirrors what came in the budget consultation last year, was a sense of a real increase in awareness across both the public and our workforce around the financial pressures and the associated kind of impacts of that, but also quite I think an appreciation of the challenges of that, and people really understanding that that's a tough climate, particularly for workforce to kind of continue to manage and deliver their services from challenging financial pressures in the background. So that came over quite strongly as well. We also have done a lot of work on the strategic needs assessment through Lindsay Webster's team, and they're working on getting that into a kind of dashboard. But in summary, there isn't, other than the continued kind of rise in demand, complexity and needs, and persistent inequalities in the city, there haven't been any real specific changes around the kind of demographic profile or big shifts that would impact in terms of changes to the strategic plan. Obviously, the strategic plan set at quite a high level. There are kind of changes to the detail of the data that would impact at service level, but not so much at this kind of higher level. And we've seen some really significant legislative and policy changes over the last 3 years, particularly around health and social care reform and the population health framework. But we are existing of the IJB strategic plan, which actually is already very well aligned to those changes. So in some areas, we've really preempted where the national kind of focus was moving to in terms of inequalities, early intervention, prevention, integrated working, all those sorts of things were well integrated already. So we've done a bit of future proofing in that. So the conclusion in section 4.4 that the strategic planning group have reached is that in the broad sense that the strategic plan remains very much fit for purpose in terms of its overall content and format, but particularly around the ambition, the values and the 6 strategic priorities. It's still well aligned to the needs of the population, the preferences that people express in the engagement process, and also the kind of national strategic direction. But we did recognise that there needs to be some revision around the detail of the strategic shifts, and really that reflects the challenges around resource levels. Not that money is were increased 3 years ago, but the context has really significantly changed over the last 3 years in terms of having a strategic plan that can be delivered reliably within the resources available to the IJB. And I know we're all pointing to that in a minute in terms of moving into budget setting for next year. So a real sense that we probably need to do a little bit of work to revisit those, to perhaps rationalise them in some places, but certainly to prioritise them and recognise that some shifts may move at a scale and pace that's slower than we had anticipated 3 years previously. So it's not that they don't remain important, but their ability to deliver them need to be stretched over a longer time period than we had imagined 3 years ago. It also gives us an opportunity to look at it to refresh inequality outcomes rather than have to do that in another year's time, to do that in a neat way that makes sense for the public in terms of one revision in the plan as well. I'm not saying more than that about the process because there's a lot of information there in the report, a lot of hard work that's going on around engagement and the strategic needs assessment as well. Happy to take questions.
Yeah, thank you for that. Makes absolute sense to be doing the equality part of it as well, rather than doing a year anyway. So that's good. See, one thing at the engagement section, like most of them are, yes, well, most of them say partly, and I think the family part of this engagement process, I guess, I think I'd be saying partly to most as well. I don't think that's something too disheartening about it, people being partly. It's clear that the resources we have available to us, we can fulfil everyone's need all the time, unfortunately. So the one that did stand out a wee bit is do you think health and social care services have become easier to find out about and access? No was 47% there. So I think there's some work to be done on that people know what services that are available and how to access. I have a couple of hands up. Bob was first. I'm going to so Bob Benson.
Thanks very much, Chair. I suppose within this paperwork, and thank you very much indeed for just identifying where some of the strategic shifts need to happen, because as you say, things have changed quite a lot since 2023. What I'm looking for assurance about is around some of the statements in the narrative around realism about public health framework and the renewal framework itself. And I'm just wondering, within that language, does that suggest any underplaying of what we might be doing with population health? And indeed, the statement around inequalities is absolutely relevant to that whole area. And I'm seeking assurance that we will not be diverted away within some of the language and the narrative from what we know is an urgent priority given the overall health needs in the Dundee population.
Yeah, I mean, I think, well, there's agreement and an expectation from the strategic planning group that we stick with our 6 priorities, which include inequalities, and probably the self-care one is what we refer to as that covers significant parts of the kind of early intervention and prevention agenda. There's also links to population health, which I think we need to strengthen further in the final priority that's about working together. So that was one where we put this in this where the IJB is perhaps not the lead partner, but we've got a really important system-wide contribution, and I think we have an opportunity to work with public health to strengthen some of the strategic shifts that are there, as if we're doing revisions this time round. So I don't think it's a shift away from that, the language of it or the kind of commitment to it, but I do think there's a scale and pace issue that we have to address and be really clear that we have a plan resources available to you. It's about that, and obviously that if we do agree that there's revisions to be made, the IJB will need to be part of the process of agreeing what those might look like and how we prioritise within what is there as well.
Thank you for that answer, and I'm really pleased that Kate Geary is here today, because then at least we've now got a focus on that, and that would inform this work going forward. But I just need to be assured that we're still going down that track as we understand it from the needs of the population health framework. Thank you very much indeed.
Thank you. On page 24, additional opportunities. I'm not sure if it's back online or not, but I attended the event that's being discussed. It was the Artificial Library, and I went in with my communities hat on, and it was really, really interesting to be in that room and hear a lot of the evidence and the big differences between self-care. Somebody's self-care was going out for a run and getting a massage, and I couldn't think of anything worse than going out for a run and getting a massage. So it's really horses for courses, isn't it? And I heard about health issues in the community at that event, and I'm now taking part in that course. And what a revelation it's been. I'm just learning so much. And one of the really interesting things was around the table, one woman, and this whole thing about you don't know what you don't know. One woman had never heard about the GPs and social subscribers within GPs. And she was kind of totally taken aback, but off to investigate what it was all about. So basically my point on this one is actually being out in those 6 communities, delivering this sort of thing, which is obviously very much an IJB thing, the Health and Social Care Partnership thing, and a communities thing. If you get people there, then they're not spending their time in crisis, and communities are the best advocate for communities, and just want to say how incredibly impressed I am by it, and also those practitioners that are delivering it. And the support is there, not just, right, this is what this means, but it's support in literacy or computer skills, all those various things that tie in it, and seeing how empowered these communities have become. So bravo to everybody involved, including obviously Sheila and her team and the community health team. And I guess within that, from a public health point of view, these groups are telling us directly what's going on with our public health. So yeah, keep up the good work.
Thank you.
And I'll expect Ken to give me my certificate when I pass.
That won't be happening. Oh, God.
Oh,
Councillor McHugh.
I want to come back to the issue that you raised, Ken, around the engagement report. There are some important messages, I think, in the results. Ken's already highlighted the access one. There's another one about, do you think health and social care services have been working well with people to design services? I'm interested to know how these, well, pretty poor results actually, scores, filter through the strategy. How does that work?
I think a few things about it, Dorothy. I think there's some particular points of feedback that we pass on, and I know Joyce is always very good at these events where there's feedback about particular services that we might not include in our public facing document, about passing that back as well to individual managers to consider both good and stuff that isn't so good. So firstly to say that where it's specific, that is shared with services. In terms of looking into the how does that work in terms of the strategy, I think those are some of the key bits of information that we need to think about in terms of what we do next to assess some of the strategic shifts. What do we currently have in, where does this feedback and some of the detail that sits beneath it aligned to those, and other things that we're missing around about that, and how do we prioritise some of it. I think in some of these areas we'll need to go back and speak to people further about what's underneath that. This is similar in some ways, I think, to the National Health and Care Experience Survey, where we get 34% of carers feel that they say that they feel supported in their care role, but we also know that 100% of carers supported in the care centre say that really supports them and helps improve their outcomes. So, what's sitting behind what people have said, and we've got a bit of that, but perhaps not enough in some of those areas, and particularly the results are clearer. I would want to know a bit more about that. So I think it's the start of a conversation rather than getting to it. But you might be about that, Dorothy. But I'm also happy to take views from others about what else that would look in terms of what we do next.
Okay, thank you.
Recommendations. Are we happy to accept the recommendations from 2.1 to 2.5, and in particular to progress the statutory review at 2.1 and to at 2.3 to approve the recommendation that as part of the revision process, quality outcomes should be reviewed, and 2.4 to instruct the Chief Officer to support the strategic planning advisory group to devise the strategic shifts, etc. Happy to approve? Yeah, thank you.
Yeah, that
But
takes
for
us.
those who are happy to approve, just read it. No one said otherwise.
So that takes us then on to item 7, which is the carer strategy 2032. You have this for a decision, but before we move on, could you please note that there's been a change to recommendation 2.2, which should now read approves updated carer strategy for their interests. The revised strategy will also be submitted to Dundee City Council in due course, and the IJB will be advised of their decision thereafter.
Thank you. So yes, this is to seek approval of the proposed Dundee Care Strategy 2026-2032. We've deliberately gone with a 6-year strategy, but it will still be renewed in each 3 years as required. It's also to around the revised carers short break statement. As Arlene has alluded to, because the strategy includes both adult and young carers, the IJB is asked to approve the content relating to the adult carers aspect only. And the Dundee City Council Children Families Committee will approve the elements relating to the young carers. This paper is not, sorry, I was already covered that bit. And the refreshed strategy aligns with the updated national strategic outcomes noted in section 4.2.3. Whilst we do not have the full details of the care formats, changes in May that we have included elements of that that we do know of, but the delivery plan will pick up any other aspects that are not covered within the strategy document itself. The adult carers, sorry, the carers short break statement, that will also need to be reviewed after we have the full details in the May papers, probably sometime around the end of the summer period, but we didn't want to delay the updated statement going in now. Once we do have that final detail, we will go out to wider engagement and consultation again to make sure we're picking anything up at that. Happy to take any questions.
Councillor Scott.
Thank you for this. It was really interesting, and I think of carers, but not think of Martin, and he's not here today. So hopefully he's pleased with what's in here. My question was around short breaks, and for me, a short break was all right. Okay, going somewhere for the weekend and you know just shut up. But then reading and learning more. A short break could be going, to the Olympia and going swimming and just getting out of your head. So which brings me on to the relationships that exist between the Health and Social Care Partnership and the Leisure and Culture delivery service. How close is that? And I seem to come across that a lot of the sort of short break stuff could be going through the care centre, and what kinds of relationships do they have? And I also had a question with regards to page 104, and it was the impact assessment, where it talks about managing civil partnership. No impact, there's no specific work regards to impact for carers in this group of the population, but within the body of the document, it talks about the fact that many people who are my mum's age, who've been caring for 30 years, don't see themselves as caring because it was in sickness and health. So surely that journey that we're on, which seems to be picking up, because it seems to be men who are realising now that they're the carers, if we get this right, that should have an impact on marriage and civil partnership. Or am I picking that up wrong?
I think it's quite difficult when we're doing the equalities impact statement, because sometimes we don't really fully understand what those impacts are. At this point, we didn't expect there to be any direct impact on that, because the impact is on the person as an individual themselves rather than as part of that relationship. But I take on board that it's maybe an area that we need to look into in a bit more detail.
And I also say that I think you're right, Lynn, that that's a potential positive impact. If carers are supported, then the person that they look after won't have as much risk of needing more care from other people. So, I think that we'll bear that in mind. It is very, very hard, as you say, for that older generation and even a younger generation, where you've made a commitment for in sickness and in health to continue. It doesn't make you not a carer. And I continually say to people, well, you don't say I'm not a parent when you're looking after your child. So why would you say I'm not a carer?
And there were a lot of hands up, so apologies if I would take.
Sorry.
Did you want to?
Just another part to the question that
Yeah.
Councillor Short asked. So in relation to the relationships with various organisations, probably don't have as close a relationship as a partnership, Dundee Health and Social Care Partnership with the likes of leisure and culture when we could, and it's an area that we'd like to explore. But the Care Centre, they have their own short breaks fund that's supported by us, and they have a lot of really, really good relationships with a whole range of organisations, and they regularly get free sort of, you know, trips to the gym, free facials, those kind of things donated to support as well. So some of the Care Centre that's probably really, really good and well established. We probably need to do a little bit more work around that.
Thank you.
There's an organisation called Hospitality that the Carer Centre are signed up to, so it allows them to go around businesses looking at that, and I know leisure and culture haven't been excluded, and the very successful partnership with leisure and culture and a fair amount of other agencies led to encouraging women's swimming and women carers swimming a few years ago, and I'm sure those good relationships will continue.
Obviously, there's a lot of hands up, so apologies if I don't take you. I'm just taking people on the order that I saw the hands both online and in the room. Firstly, Dorothy.
I've got a couple of questions on my name. One on the report and one concerns the impact assessment. First thing I wanted to ask about is older carers. I imagine they're lumped in with adult carers. And it concerns me a little because they will have specific needs. I'm obviously a council, older people need the same services as everybody else, but they need to deliver differently. And I think that applies to older carers as well. How do you I think the vast majority of our adult carers are actually older people. And the whole principle around adult care support plans is that it's a very individualised assessment. So it's not about a blanket one size fits all. It's about having that conversation with the carer, whatever their circumstances are, what is a meaningful break to them? How do we support them to achieve that? And then there's a third element, which is this something that requires additional funding, or can it be supported through the current supports or community supports? So there's quite a few steps in that process. Shooting, thank you. Glad to hear that. The impact assessment, I noticed in a number of areas, were marked as no impact, where it said there is no specific work regarding impact for carers in this group. Gender reassignment, marriage and civil partnership, pregnancy and maternity, inflation leave, there are others. If there's no specific work on the impact for carers in this specific group, I would suggest that that's not known. I don't think you can take that step and say there's no impact, because you actually don't know. So take that on board. Again, it comes from that premise that every assessment is an individual assessment, but from the qualities impact assessment, we're not aware of any specific. So you don't know rather than there is no impact.
So how does that work then? Will that just be revised for the archives, I suppose? Given that you agree with that, but in terms of the impact assessment, then? Yeah, thank you. Next, I have Paul Gallagher.
Hiya, thank you. Yeah, just like's been said already, a really fascinating read. And I think that what we've already spoken about the short break, I'm the same. I think of a short break, I think, oh, a weekend away in a cottage by the sea, but some of these were just, going out for a run or going to the swimming or whatever. And I think that really hits home as to how the intensity of a carer's life, that for them would count as a short break. So I think it's hugely important that we're backing that in any way we can. I've had a chance to be at Dundee Carer Centre and see the young carers through the corner, and there's some really fantastic work going on there. I loved in this report that we had the real stories and the impact that can have, in particular Eve's journey. The impact that this has had on her life is absolutely life-changing from where she can go from there. I mean, there's great work going on. There's definitely still further work to be done to have a meaningful impact. Like it's been mentioned, only 34% of carers feel supported to be continuing in their caring role, which is higher than the Scottish average, but it's still not good enough. So I really hope that this new strategy helps to align, or the way we go forward with services helps to align with this new strategy and really support carers where we're needing it. That being said, health and wellbeing improved 99% reported that, which is fantastic. So I really think we're on the right track. And it's great to have this document now to really kind of put some structure behind it, I suppose. And fantastic to have our service user rep. Hello and welcome. But that's all. Thank you.
Yeah, thanks for that. And actually, I have the service user rep as the next person to speak.
Thank you. I have two questions, if you don't mind. One is I echo the comments that have already been made with regarding access to the information. And it should be everybody's business, not just if you're engaging with the carer centre, I believe. You know, so I, as a service user and an unpaid carer at both ends of the spectrum over the years, you know, there's been so many missed opportunities to relay opportunities of support, including short breaks. So I would really like to see further work done on how we can get that information to people who we know about and how we can actually get that to them so they can be supported better. I really welcome the carers strategy update and all the work that's gone into it, and also the Eve story. Yeah, that was really powerful, absolutely, totally identify with Madison's words of care. It can be really overwhelming and feeling emotionally depleted. But these short breaks and these conversations that happen in an adult support plan are really welcomed. The next question would also be about, is this truly needs-based or is it needs-tested when it comes to eligibility? I don't think it's clear currently in the short break statement about what does eligibility mean. So I know that you've also said that there will be wider engagement, so maybe that's a point to bring up there, but just initial responses might be useful.
Yeah, thanks, Nicola. Yeah, when we did the short break statement, there's two elements at the end. Excuse me. This is page 93 of the combined papers, page 17 of the short break services statement. There's two tables there. The first one is the layout where each sort of risk banding, what's the services that we'll be able to access when they're assessed as meeting each of those bandings. What we've done in Dundee is, although we have eligible criteria for funded care packages by social work services, we've always taken the approach that everybody should be getting support. So we signpost people to other services, third sector, voluntary services. And we've tried to do that within the document. The second part is the examples, which actually shows them where you would be entitled to statutory services. So paid respite, paid short breaks. Trying to put in examples of where the waiving of fees would come in, because although that's been in the legislation for a long time, we've only recently actually been able to put mechanisms in place to be able to support that. But I take on board what you're saying, Nicola, that it's probably still not clear where eligibility comes in, because everybody should be able to get access services. But when it's funded by Dundee Health and Social Care Partnership, that's where the eligibility criteria kicks in. So we will take that on board. I would really like, if you're happy to do it, when we do that refresh after the legislation comes out in May, to make sure that your perspective, if you're not quite understanding what we're trying to say, then other people definitely would. So it would be really helpful if you'd be willing to give that once over for us as well.
Thank you very much. Yeah, I would participate.
Thank you. I have Bob Benson is next.
Thank you very much indeed. And actually, really following on from what Nicola's just said around eligibility criteria and also the overall funding of this work. What's clear within the strategy, and I really enjoyed the report because I thought it outlined just exactly the kind of information we would expect to see within a carer strategy. One of my, I suppose, concerns, and particularly thinking about budgeting for next year, is going to be the expectations that we will have set up within this strategy without real certainty in terms of the financial position to support this strategy. And I'm minded when I look at the section 12, which is looking at the Dundee IJB, that's on page 72, Dundee IJB financial position. It seems rather uncertain. And if you look at the strapline at the bottom there, it says that all the strategies in the world won't matter if professionals ignore them and there's no funding to implement. So there's a key issue here about the expectations that we are setting up here. And it's also worth just putting or just raising awareness here is about there are new voting rights for carers and service users and third sector representatives that will be implemented by the end of September. So there are implications here now where these representatives will have voting rights on budgets as well. And we need to understand the implications of this too. So thank you.
Thank you, Bob. Last but not least is David Cheap.
Yeah, thanks, Chair. I won't add much more to what's been said, but I found it a very humbling report, actually, and thorough, as Bob has just said, as far as the strategy is concerned. There's been a lot of talk about the short break statement, and that was really where my, I wouldn't say concern, but question really refers to, because it refers to short breaks. I think, as Colleen said, it could be anything from quite surprised, an hour a week, which I thought, how can that be regarded as a short break when that's all that can be offered, to much more expansive weekends, respite, etc. And my question was on funding of that and eligibility for it. I couldn't really get from the report myself how differentiation is made for people on eligibility to the extent of the care, the respite and short breaks is made. Could somebody just give me a very quick summary of that, please?
Apologies, David, can you repeat that last bit of your question, just so I'm clear on what I'm answering?
It was just clarification for me as to how eligibility is decided for the type of respite and length of respite for each individual applicant effectively. What makes the differentiation between people for the amount of short break respite they're offered?
So there's not a straightforward answer to that, because it is a very complex process during the assessment. So what we would start with is the adult carer support plan. We would have the conversation with the carer to work out where is it they feel that the pressures are, what is it that they're not able to achieve because of their caring role. We would have a look at that. We would identify what their desired outcomes are. When I say desired, it is about that agreed assessment. So it may be that somebody wants a week in the Bahamas, but that's not realistic, you know. But if somebody is needing a week's respite and they feel that, because a lot of this is subjective, so if they feel that they need a break for 1 week, 4 times a year, that would be assessed as to whether it was reasonable or not in terms of the assessment. We would then look at what is actually provided for that person at the moment. What is the replacement care that would actually be required to allow the carer to have that break? Now, for some people, the carer might only be doing 3 times a day, sort of for 1 hour supports, and they're doing pop-in visits. If it's, for example, a daughter, So we would replace that care. So we would put in a 3 times a day package for that period. However, if it was one of the examples that Dorothy was talking about, where it's an older person who's actually in their 80s and caring for their 80-year-old husband, then that's much more complex. It's more likely that they will be providing 24-hour support, and we would look then to provide that 24-hour support. It also gets very complicated when we look at the chargeability element. So if that service is for the person themselves that's being supported, and that's already technically in there and it's a bit of a supplement, that might still be a chargeable respite service. So, sorry, I'm not explaining this very well because it is so complicated. If somebody was going in for a week's respite, for example, in a residential care home, if that person only actually needed that 3 times a week, but the relative would be really distressed and struggling to cope, knowing that that person was at home, we might still agree a respite package, but that would be a chargeable service because it's not actually the assessed needs. Whereas if in the older person's example, where they were delivering 24-hour support, we would fully fund that placement. And we haven't done that very much because there hasn't been very many people so far that have come through that have actually met that criteria for the full waiving of fees. And that does clearly have huge budget implications for us, but we're trying to do it on the basis of that need for that individual. And when I say individual, it's not just the carer, it's the carer and the supported person, because you can't separate them out. So it's a really, the guidance from the Scottish Government is about 150 pages, and we've managed to reduce it down to around 56. That's how complicated it is. So I'm sorry I can't give you a more straightforward answer, but
Listen, that's much clearer, and you actually answered in your second part there on the funding side of thing, the determination. That's what I was looking at, is because there could still be chargeable elements depending on the need and the need of the carer as well. I appreciate that. That's absolutely fine. Thank you.
Could be chargeable, would it be chargeable but subsidised?
yeah, so apologies, because a long time since I've dealt with the respite aspect, because it is still quite a significant cost to the person. I don't think it's not fully means tested, is it? I'm trying to remember.
There's different elements, so there's a kind of fixed element to it, which is regardless of that is assessment itself. So the rest of your charges are complicated as well.
Effectively, your hotel and board costs, so the food and sort of electricity, those type of costs that you would pay at home anyway, they're kind of the fixed costs, but then any sort of more practical elements, sorry.
Yeah, it's right. Yeah, so we could extend the meeting till tea time. But yeah, I think you give it full an answer before the honest answer, so thanks a lot. Well, I'm going to conclude the discussion on this item. Rick, can we approve the recommendations from 2.1 to 2.4 to note the work undertaken, particularly to approve the updated carer strategy? Someone tell me what for the interest, Mina?
Yeah.
We go again, for your interest, so in relation to the IJB's delegate functions.
Oh, okay.
So this case, other services.
Yeah, so approves the updated carer strategy, which will also be submitted to Dundee City Council to at 2.3 to approve the revised carer short break service statement, and to note that the delivery plan will continue to be reviewed.
With the amendments, Chair,
Sorry?
with the amendments
Well,
The members to point.
that Arlene had.
well, thank you, Brandon.
Yeah.
Yeah, I wrote them down too, yeah. Well, I don't always read out every line, having said that, but yeah. And I didn't intend to read out that either the date or the fact that the IJB will advise something to send it after, but yeah. Yeah, I should have actually, because I didn't, you're absolutely right. Thank you.
Okay, so that takes us on to item 8, strategic risk management arrangements, and you have this for a decision.
Yeah.
Okay, so this is a fairly kind of comprehensive update paper around what we've been doing on our strategic risk management arrangements for the IJB. I think both board members, particularly performance and audit committee members, will know that since probably the middle of last year, we've been trying to work on revising and really updating the arrangements that support the IJB strategic risk management. Although we've been in place obviously for about 10 years now, I think we recognise that we need a really thorough kind of refresh. And we've also done some work with board members around risk appetite, and we need to kind of integrate that into the system that we're actually using day-to-day reporting on. I think that hopefully the paper is fairly self-explanatory in terms of section 4.2 and the various elements of that. I should acknowledge that we are grateful to Kirknick and Ross IJB, who had done a lot of work in their strategic risk management framework, and especially the public funds, we took full advantage of their hard work. So grateful to them for that, and obviously adapting that into kind of fit in Dundee context and circumstances where we could. We've done a lot of work to really overhaul the contents of this register, get that streamlined, make sure that we've done a bit of horizon scanning in terms of relevant risks now that maybe hadn't been on there previously, and also incorporated the risk appetite work that the board did last year. There'll be some further changes in terms of reporting templates to the IJB to make sure that our risk assessment sections are really focused on how is the content of our report actually impacting the IJB strategic risks, either indicating that those need to be reassessed in terms of scoring upwards or downwards, or there's new mitigating actions, etc. So that should be a much clearer link. That was a specific point from a previous internal audit report as well. So the details they are, I think we've got about 8 actions in the IJB's governance action plan that were about things that need to be done around risk management and the risk register. So we've scored about 6 of those off the list. There's some further work to do in terms of reporting against the risk management action plan, but also particularly at the interface with Dundee City Council and DH&SCP side for some of the risks that are shared with them, particularly things like workforce and property, which are not delegated functions as well. So we need to kind of take that in the last set. But we felt it was important to kind of bring this back and get it functioning and working sooner rather than later. So the ask is to approve the risk management, the updated risk management framework, and then to note the other work and the responsibility for that sits with the management team.
Thanks for that. Yeah, particularly just above 4.3, the final bullet point of the revised format will direct the link for IJB reports for the risk assessment. That's what could be useful. I think it'll be a guess from the next meeting.
Yeah, so we just we've got a format, and we're getting just some advice from internal audit. If they have any comments on that, and so the budget reports should be the first reports that you see with the revised format for the risk management section.
And that includes some information on risk appetite. Will that be part of it?
Yeah, so I can't remember the exact detail of that, but we can share it with members outside informally first before you see it appearing on paper. But essentially ask people to link it to the risk and risk register and to comment whether it's increasing or decreasing the risk and contributes to mitigating factors, etc. as well. So we can make sure that there's that prompt in there about whether it moves the risk either in or out with that appetite as well. We want to help with that if we can look to add that in.
And Colin.
Thank you. Yeah, just thank you for the report. It's really comprehensive and detailed. I had a couple of questions about risk reference to IJB under workforce capacity. So we've got the key contributing factors under there. One of them is misalignment between health and social care priorities and those of employing organisations. So is this just kind of a historic risk? Because I would have thought with our new frameworks coming out, population health, service renewal, everything like that, that we should be working a lot more collaboratively and in partnership, that we should have our priorities aligned across these services, rather than still having that as a contributing factor to risk for our workforce capacity. So first question is there still work there to be done? And the second question around that was that it mentions inadequate capacity within the senior leadership structure and complex governance arrangements. Does this then lend itself to be appropriate for an area of service reform and organisational restructure? Is that being taken into consideration at the moment to resolve some of these issues?
Yeah, I think.
Yeah. So in terms of the alignment of priorities, so the risk and the risk register very much reflects the content of the IJB's workforce plan that you approved last year. So I think we are closer than we ever have been to having things fully aligned across the organisations, but there's always more work to be done around that. And I think recognising that when we have a complex arrangement in terms of the employment of people by the partner bodies, but I need to deploy them in an integrated way, integrated teams, that we're always working to just further align in that. It can be, I think broadly our strategies are well aligned in that, and there's an agreement about direction of travel, but in particular instances and where there's particular pressures in the system, that can still be challenging in terms of working through what that looks like in an integrated team. That's generally that interface in the part of it, rather than anything that happens in the two individual bodies that involved in what I would say. So I think it's there. It's not that progress hasn't been made, and we're certainly a lot further forward than we are when workforce risk was originally identified a number of years ago. But I do think we've still got a way to go in terms of that fully integrated workforce planning.
I just pick up on the second part of that question, so that's for that. I think it's really important to flag that up. I think that we all acknowledge that working within the health and social care environment continues to be complex. So regardless of what reforms can happen across kind of nationally, is that sometimes that adds more complexity into our system rather than kind of takes away some of that. And I think a lot of that at the moment is still about uncertainty. So what does kind of the kind of reform agenda, what does that really mean in terms of the asks of ourselves within the integration drawing board, and also within health and social care partnership in terms of that, making that distinction between the two. And so while we continue to kind of look at our capacity, we're also more and more looking, where this we're calling being an NHS member around what the collaborative opportunities across the three IJBs and three partnerships that can maybe help with some of those consistent across the piece and challenges that we've got around governance. So I know it's a minor example, but Catherine just mentioned there around Perth and Ross had kind of developed a framework. We would expect agencies to develop our own framework, so let's look at how we can use things across the piece to kind of help with that capacity issue. So I think similarly we are kind of working more closely with our kind of Angus and Perth and Ross kind of partners in capacity, because we're recognising that with the financial challenges that we've got, the least popular option is to kind of pile money into senior management leadership post capacity there. So it's around how we can do the best with what we've got, but also being mindful of what that impact can have kind of leadership and role as well, of having a kind of quite a heavy and complex workload as well. So I think I'm kind of comfortable we can keep this as a risk, but in terms of it's how we continue to look at the mitigating actions around that, which will continue to develop.
Thank you, Chair. It's been covered.
Okay. So I see no. Yeah, Bob.
Thanks very much. It's a very comprehensive report, as been indicated, and Colleen's asked one of my questions anyway. And just a couple of things. We are already within a very difficult environment, and we're moving into an even more difficult environment. Can you refresh my memory in terms of when our next development session on risk appetite and management will be? Because these are changing documents. I'm thinking particularly round about the issue within risk appetite around reputational. I think we already know that we wonder how much this can actually really be mitigated at all, and whether indeed it should actually be there. But I would certainly like to see this reviewed at the next time we have a development session on risk appetite and looking ahead, because the environment in the current year is going to be changing quite dramatically. And I do wonder if we should be planning in advance for this, knowing that these are dynamic documents. Thank you. I can't actually hear what's happening. Could you just repeat that, Dave, please?
Sorry, there was a fire, the fire alarm test, which is very loud.
Ah, right. Didn't plan for that risk. Thank you. There is, obviously we've got development sessions scheduled for the year. At the moment, there isn't one specifically about risk, but that doesn't mean to say that we can't add one in to look at that. And actually, it's interesting we say it, Bob, because we've had a similar conversation that now you see now that members can see that risk appetite in the context of all of the other documentation, it did cross the mind that you probably would look that might change some of your views around where that sits and what you might want to look at. So happy to take that away as an action to look at when an opportunity to do that sooner rather than later. Thank you, appreciate that.
So I see no for the last, we're happy to accept the recommendation to note the work that's been undertaken and to approve the revised Dundee IJB strategic risk management framework. Thank you. Now, we were talking about short breaks earlier on, and I intend to call a short break of 7 minutes, given it's
very precise.
So we'll be back here at 10 past, because it's now 11:03. We move on to the next item, please, which.
Yeah, so that takes us on to item 9, application for transformation funding for stock control and test of change. You have it for a decision.
Happy to have Fiona Bartlett online here to talk, speak to the paper for us. Good morning.
Good morning. Thank you very much for your time. I just want to talk about this paper that we've proposed today. So we're looking for support for funding from the Transformation Fund to look at a test of change to implement stock control initially across CTACs, which is the Community Care and Treatment team, and then also sitting within our teams across Royal Victoria Hospital. And this would be working closely with our logistics team from Ninewells. We recognise that a lot of stock is ordered individually through various different teams, which creates waste, it creates duplication. There are some elements of stock which we use that we don't use very often but are high cost, and therefore they create some wastage within the system, but also cost efficiencies are not there. It also recognises that there are times across systems where you've got various different people doing stock. So not only are they taking away time from their direct patient care roles through ordering stock, but also to put them away. So if we were able to create a test of change, logistics have identified that there are areas where we could create efficiencies across the system. We would hope that this would then create an ability for us to create a community-wide ability to look at stock control. But we would want to start with these two areas first in a phased approach. Thank you very much.
Thank you for that. So spending 80,000 to spend today, 100,000 per annum on the current basis seems like a no-brainer to me. There is a question from Councillor Shaw.
So obviously, like you say, this is a no-brainer, spend saves, test to change, all these lovely expressions. But my query is, when we have like almost $250 million coming in on an annual basis in the city, 80,000 is like cheap chips. And is there not like a level where you can just go forth and do what you need to do?
That comes around here.
Yeah.
Comments?
Yeah, so the reason it's here is because it's around accessing the IJB's transformation. than the reserves of the IJB. So in terms of the governance, it's not an officer level for us to just go ahead and just do it if you like. Within that. And the reason it's not in our kind of current sort of expense because it's a best change. As you know, with the next papers and the budgets now, right? So using this as a test to change the translations.
Okay, thank you for clarifying.
Yeah, and I see Collins' hand up as well.
Yeah, thank you for the paper, and absolutely, I think especially if we can release staff back to direct patient care and create efficiencies within the system that way, it sounds great. I just had one little question, because to me that's huge numbers of waste every year. So the 100 grand saving, are we taking into account, are we deducting the cost of the salary of the stock controllers and still getting the 100 grand saving, or is that still to be deducted? I didn't explain that very well.
Yeah, so we are expecting that it will be 100,000 over and above the cost of the posts, but that's projecting when we move to applying it to the entire partnership. So at the moment with the test of change, it's small returns initially, but that's what we expect going forward.
Okay, thank you.
David.
Yeah, that maybe muddies the waters more for me. I was reading this, that this was an 18-month funding cost, which would then provide ongoing savings of £100,000 per year. Are we saying that this is the £80,000 is the cost of for 18 months, but if it's successful, that there will be an ongoing cost beyond that? I think maybe what Colin was trying to say in that. I think that, you know, will this be a post that will be created beyond 18 months and will still be needed in order to provide net £100,000 savings?
Yes, you're correct. So the initial costs are slightly higher than we expect the maintenance costs will be going forward, because at this point the logistics team are going to be helping us set up an entirely new system for managing stock control. So it's front loading the costs to get that system set up. At the end of that process, we'll have a clear steer then on just how much staffing need will be required going forward, which we expect will be significantly less than we're putting in the first instance.
And can I just come back on that one? That's fine. And I mean, it sounds like it makes complete sense, but will there be some form of audit on this later on to make sure what actual value it is providing back to us rather than just an additional cost?
We are hoping that, so working with the logistics teams and they're looking at our boxes, they will create some KPIs around that. So we'll look at the reduction in waste. We will be able to look at these high value cost of, for example, wind products, which are high cost. So we would be looking to see that reduces the volume of waste that's attached to that. But from the senior charge nurses and team leader availability, they'll be able to see the reduction in time that is used for putting away stock and ordering stock. So we'll be able to evaluate that as we continue through the test of changes.
Okay, and will the results of that come back to the IJB for us to, because I mean, part of the thing when we're talking about using funds for transformation funds, we want to see what the end result of this will come back to us if we're approving this today.
Yeah, I would expect it would bring an interim update report in around 6 months' time.
That's fine. Thank you.
Yeah, and finally, Raymond Marshall.
Yeah, thanks, Chair. Yeah, I was trying to understand what the 80k was actually being able to be used for. Is it to fund a post? Is it to put in a new system? What? Because it doesn't actually say what it's for.
It's for 2 post training. So initially it would be for 1 part-time post to sit across CTACs, but we would need a full-time post to sit within RVH to do that whole creating of the system and do the stock control and implement that.
Right,
so it would be for 2 posts over 18 months. I couldn't
see the 2 posts on the paper. I don't. Apologies if I've missed it. But anyway, there was that comment as to what it was used for, but also as well. So there's. I'm on about duplication of work here as far as So there was and I'm trying to think what we call it. It was called Everyone Counts. It was launched by NHS Tayside. Around a 300k that was set aside for these kind of things, which was if someone comes along and says, so a number of the stuff that's been set aside in that Everyone Counts is, or some of the suggestions are what you've said, Fiona, around, we seem to have, we either hold excess stock or we purchase items that are expensive and could be cheaper, and they're linking in with our procurement colleagues. So I'm just concerned there's a bit of duplication there. So if the Health and Social Care Partnership does it, and then they're also doing it elsewhere, given that it all comes through the same procurement route, you know what I mean? So I'm just asking you, you need to link into that, because technically you could not use the Dundee and look for the monies from that Everyone Counts initiative that's been set aside. You know what I mean? It's just a suggestion, but I think there's duplication here, because if you're doing it within the Health and Social Care Partnership, it's suggested it's also getting done within the procurement set of NHS Tayside anyway. They're looking at consumables and what sits within stock control. Just for your awareness, thanks.
Thanks, Raymond. Yeah, we did. That's where this work has come from. So the original work that was carried out within acute services, we were advised that we could not access the funding, but they would take the learning that they did from that piece of work, which is why they are confident that they can replicate that work for us, but we would still need to pay for that staff time to allow us to do the work.
Happy with that, right?
Yeah, it's just a duplication, Ken. You know what I mean? I think some of the stuff around Everyone Counts is that we've got resources that are getting used within all the ward areas, any area, right? We just seem to order what we order, you know what I mean? And they're asking to look at that. Now, some of that is restricted due to our procurement elements that says we can't procure certain stuff because of, so we can't just go to Amazon or eBay and just buy stuff and get it delivered the next day because of the stuff that sits there was procured. But there's also things about the stock control. So I was just asking if it's linked in, because if Dundee's going to do it and spread it out, great. And then hopefully everybody will benefit from the outcome of that. Thanks.
As I say, the learning from that piece of work that was carried out in acute, that's where they know that they have these systems that they can replicate within RVH. But we just can't tap into the funding for the actual staff time.
No other hands. We'll be happy to agree the recommendations from 2.1 to 2.3, in particular to approve the request for £80,000 of funding from the Transformation Fund. Also to receive updates on progress and to remit to the Chief Officer to issue directions. That's agreed.
Great.
Thank you.
Okay, so that then takes us on to item 10, financial monitoring position as at December 2025, and this is for noting.
Yeah, thank you. So this is a mixed financial monitoring report, and it says that should finish at the end of December, so 9 months of the financial year of known and actual activity, and obviously projections for the final 3 months. At that point in time when we were producing these figures, and we have a projected overspend of 4.675 million for this financial year. That is a further improvement from the previous report that we shared with you, obviously on the solar position, which at that point was showing 5.273, so about £600,000 improvement. The underlying and ongoing demands and pressures, including demography and complexity of need, these all continue, and we continue to be supporting and managing that demand as best as possible. And the key drivers of the overspend continue to be linked to community care home packages and associated spend around that in terms of adaptations, community nursing and adult placements and packages, as well as the older people. We do continue to recognise that the Dundee performance in terms of delayed discharge, that's continued to remain high through the winter period,
And we've continued to be remaining amongst the sort of the best performing areas in Scotland in terms of supporting people to returning home or to remain at home and avoid admission to hospital. Some of the key points and analysis of variances are detailed in section 4.3. Section 4.4.3 also notes as well that the latest figures do include a provision in terms of an inpatient mental health services, which from a state perspective, we've not had these figures in previous sets of numbers, so there is an additional cost pressure included in the latest figures of further £589,000. So that should be recognised in terms of the improvements that we have shown in the latest figures. The improvement does actually include an additional cost pressure. So if you take that out and compare like for like, the improvement is significantly more. But we've now got figures in terms of inpatient mental health services in terms of projected cost pressure for those services. Section 4.5 and Appendix 4 includes an update on the current plan savings, where we are continuing to be anticipating that 82% of our planned initiatives from our £17.5 million gap for this year are expected to be delivered. Still have an element of undelivered, but it should be dismissed in terms of the scale that has been achieved in the current year. Section 4.6 and Appendix 5 provides members with an update for the year financial recovery plan actions that were approved at the October meeting. So it is acknowledged that these actions and plans do remain insufficient to fully offset the projected shortfall, and we're continuing obviously to manage and mitigate against this as best as possible within the partnership services and through some management of spend of delegated budgets. Within this section as well, just for noting within the IJB membership, paragraph 4.6.7 provides a breakdown of how the £500,000 infrastructure reserve is being utilised. This was approved as part of the financial recovery plan back in October, and we confirmed that we'd come back with an update in terms of how that is being planned to be spent. In terms of progressing the efficiency initiatives and enabling the delivery of longer term benefits going forward into future years through technology and digital utilisation and agile working. So the IJB has asked about the latest position and the ongoing work to address the number spend in year. Happy to pick up any questions if anybody has any.
It's quite frustrating. 4.3.11 and 1.2 and 1.3. Key drivers of underspend staff vacancies, but key drivers of overspend of staff vacancies and obviously sickness absence. It appears to be slightly on the rise again. I mean, mention of not filling non-essential posts. I mean, I'm assuming that we don't have any agency staff. No.
The only places that we would bring in supplementary staffing in terms of agency and cost pressures are the critical posts in terms of residential monitoring services, that sort of care packages that absolutely need to be filled and the individual supported. So it is those essential areas that are critical in terms of staffing ratios that we would need to be bringing in additional staffing. So that's why we know that we've struggled in some places to be recruiting. We've also recognised through the vacancy management, recruitment management, that some posts are less critical, shall we say, than others. So these posts are not being progressed, and we're prioritising the areas that we obviously do need the direct care and the priority and the critical nature of some. But in these areas, there continues to be a struggle in terms of longer term recruitment and retention and sickness absence, and therefore these are the areas that we need to bring in additional staffing to sustain the safe staffing levels.
Thank you, Christine. Colin, can I bring you in next?
Hi, yeah, thank you. I feel that this and the next item kind of overlap a bit, so excuse me, some of my comments are around the 7 proposals that have gone out for consultation. Are you content to take my comments and questions in this part, or would you like me to wait till the next item?
If we get those comments on the financial monitoring just now, we'll pick this one up, but if, and it depends on how they overlap, I guess, because obviously we've not done the sort of route to the next paper, so it's trying to.
Yeah, no, they correlate so closely, but I'll wait till the next one then if it's because it's more specifically about the current 7 proposals that have gone out to consultation. Thank you.
Bob.
And thanks very much indeed. And it's I could almost kind of like re-script it back to previous reports we've had about the same challenges each time. And some of the key issues that are emerging, and I think have been well identified within the documentation, are around the cost of staffing and how we can maximise that. I think Dave earlier alluded to the cost of getting the right kind of management in as well, and the implications of not having that. And I was intrigued by the section under psychiatry of old age about the benefits of collaborative working across other health and social care partnerships. And I'm wondering to what extent, given the kind of challenges ahead, as to what work we could do that would help to offset some of the staffing issues that we have, which we clearly outlined, that could actually align ourselves with other HSCPs to actually save staffing looking ahead, because they have exactly the same challenges as we have. And I wondered, in the light of what we will be thinking about ahead, as to what work could be done within this financial year to look at how we could actually look at aligning our staffing across other health and social care partnerships as well. And I think particularly around that area, around management, I think would be a way forward. I think that's what ordinary businesses would normally do. And I'm just interested to note that, given the intractability of the kind of figures we have in terms of recruitment, vacancies, absences, etc., it's not fixable within what we currently have. So we need to redesign, I believe. And that's a recurring theme that I have. Thank you.
Yeah, no, thanks for that, Bob. I think it's going to be really important to highlight that. So just to give some level of assurance that the 3 chief officers across kind of health and social care partnerships in the Tayside, we are kind of recognising that challenge. We've all got different challenges within our systems. Some of them around kind of how we can recruit to areas that are kind of more difficult to recruit to. I think within Dundee, we are probably relatively fortunate that recruitment is not as significant an issue for us, because Dundee is still a place people want to kind of come and work with. Some of the rurality kind of factors kind of inhibit some of the particular roles that's gone through in particular services. I can't remember which NHS members were on the NHS Performance and Resources Committee last week, when we talked about the psychological therapies and the kind of the difference and variation around performance across Tayside around that, which is largely around how we can recruit to different kind of particular areas. So we're recognising that, and again, ways Chief Officer kind of mentioned earlier, we are kind of recognising that if we continue just to look within our own kind of restrictive resources for responses to some of the challenges, it's not going to give us what we need. So it isn't very much looking at where are the opportunities to look across. And so when we're looking at things like service reviews, are we looking at just a Dundee service review, or are we kind of wider where it's appropriate to do so? Some areas will be kind of easier than others to build on some of the kind of the collaborative work that we already do. So, as you know, we've got the kind of joint equipment service of Angus that's been well embedded for a number of years. But that kind of works because of the geography and kind of how Dundee and Angus can work together around that. So the first focus will be on the kind of more local population kind of areas that are kind of very close to each other. But just give the assurance it's on our agendas, and it's what we're looking to do for the future.
Oh, thanks, Dave. That's really helpful. And Dave, can I just follow up on that? When we come to looking at workforce planning, can we actually have a session on this as development so we can talk this through? Because I appreciate it, it's not simple and straightforward, but I do think there are potential recurring savings that we will have given the expectations that are going to be placed upon us moving ahead. So thank you for that.
Jane, would you like to come in?
Yeah, probably just to mirror what Dave just said there. I think one of the positives we have now, we've got 3 nurse directors, 1 in each of the partnerships. So also we are looking at opportunities across from that wider nursing perspective across both all of the partnerships, what opportunities are out there for enhancing patient care. So that's also on our agendas.
Thank you.
No other hands on this report is about voting. Can you move on, please?
Item 11 is the IJB 26-27 budget outlook update, and this is also from them.
Yeah, thank you. So the IJB has to formally go through the paper, the related position in terms of the budget planning process for 26-27. That's a bit of a reminder, so it's government budget statement announced on the 13th of January this year, and it needs to be working its way through the parliamentary process, becoming statute. As a result of this, the health boards, local government and IJBs across the country are all continuing to work through local implications and options to determine how the funding available to us should be distributed. At the stage of writing the report, there's a number of figures in the report, and these are all based on assumptions at that stage, based on the best intelligence that we have available to us at that particular point in time. But some delegated budgets from our partner bodies from NHS and Dundee City Council. These won't be finalised until their local budget processes are finalised as well. So we are working with assumptions at this point. Council budget setting meeting is the 5th of March, and NHS Tayside will set their budget in April. But by the time we're coming to set our GB budget, we should have a fairly confident position from NHS Tayside in terms of what we pass through. So based on that known information at that point in time, anticipated cost pressures and assumed funding uplifts are detailed through 4.2 and 4.3. And as a result of this, the IJD's delegated budgets are projecting to have a £12.6 million cost pressure for 26-20. Section 4.5 of the report. So under the scheme of delegation, the IJB must set a balanced budget by the 31st of March. We have our meeting scheduled for that day. And officers through the partnership who are continuing to be working to identify efficiencies, opportunities and options to close this gap. Section 4.4 provides IJB members with some additional national context as well in terms of all the Scotland published, highlighting that the pressures faced locally in Dundee are replicated across the country in terms of the health and social care demands and pressures and increasing position. And that full system collaboration and transformation is required to address these challenges. And despite this national context, it is noted that no additional funding was announced through the Scottish Government budget statement to explicitly support these health and social care demands. Funding has been distributed to our partner bodies and in terms of whole system positions and pressures, and also we await the budget settlements from our partner bodies in terms of finalising where funding may be distributed. Key drivers and cost pressures are noted in section 4.6, including pay award uplifts, demographic and demand pressures, inflationary pressures, and adult social care real living wage increase, and national care home rate anticipated increases. And also acknowledging that our 25-26 approved budget relies upon use of reserves and other one-off funding sources which are not anticipated to be available going into 26-27. 4.7 of the report details in the indicative efficiencies initiatives and savings that have been developed by senior management working with our budget holders and team leaders through the organisation. And we're obviously in terms of understanding the risk and impact of delivering these as well. It is acknowledged that a number of these initiatives and proposals will require IJB approval at the budget setting meeting in March.
due to strategic impact and whole system risk. These proposals are currently out to public consultation, which was launched on the 3rd of February. It's a link in the report to the consultation. The feedback from this consultation will allow officers to finalise the proposals and provide IJB members with the required information to allow an informed decision to be made on budget setting date. And as a result of these, the scale of the financial challenge position that we're faced and the projected gap, along with the fact that the budget announcements from UK and Scottish Government budgets were about a month later this year than in previous years, the IJB budget meeting has been pushed back slightly to the 31st of March as well, just to allow us that time to collate all the feedback from the consultation and produce the required reports for yourselves. So IJB is just at the last to note the current position.
There was an additional 20 million Scotland White announced last week. What impact, if any, will that have on position?
We are still waiting to get the details coming through the Dundee City Council. So there's additional 20 million that we understand is being passed through to local government across the country, which, reading the headlines that have been published, is to support the real living wage cost pressures for both adults and childcare and childcare. So having done a quick sort of desktop analysis of that, I am hopeful that will equate to just under £500,000 coming to Dundee IJB, but we've not seen the details coming through and to understand how that needs to be, that will be distributed. So I will be touching base with Paul Thompson and Clive Lesker from the council to see if they've had any further documentation and what the numbers are.
Can I bring in Dave? I'll get come to you in a minute, Paul.
So sorry, just to kind of finish off that point, because I think just Christian's right, we're still not, exactly certain what that's going to look like. The indications we've had from operators are causing that is that it's a non-recurring stage, non-commitment. So that's just Christian.
That's the end.
So we are kind of, so there is work ongoing through getting close that and nationally around that kind of common in the future. So I do think it may kind of help us through 26, 27, but we what was a risk again future years. It's not so, but it's directly linked with what was on the adult learning, so we can get the wage for it. This is what I'm going to external providers. So it's that pass through of funding. So we get the money from through Dundee City Council, and we pass that straight out to the providers. So there's not. So the bottom line there for us is at the moment it was not fully funded policy. But it should be now.
So if it's passed through to the sector provider, then it doesn't help our 12.6 million deficit position, or does it?
It will, because at the moment I have incorporated the full cost pressure in terms of provider uplift into our cost pressures, and then taking into account the funding that we're anticipating to be receiving. We do have a budget development session with IJB members in a couple of weeks' time, and I'll be at that point, council will set its budget, and I'll be refreshing our numbers and which ones to be discussed at that, and then we'll be presenting these same numbers to the budget.
I have two others.
Okay.
Yeah. I'll bring in Paul next, please. I'll have to you.
Yeah, thank you. Yeah, that's really good to hear that there might be some extra developments in what's available to us financially there, and also really grateful for the previous comments from both Dave and Jane about collaborative working. I think that's really positive news to hear going forward. Just I think as we've had a few private sessions where we've discussed this, I think just in the interest of transparency, I would like to reiterate some of my points that I'm sure many of you will have already heard. But I think it's important that the public are also aware of the questions, to let them know that the questions are being asked from us, and that we're fulfilling our duty to them. So I've had a busy week, like I'm sure a lot of us have, but thankfully I've had a little bit of time to look over the Code of Conduct, as that was previously brought up to me in the previous session regarding my lack of support of the 7 areas that have gone out to consultation because of my concern about the impact to service users. So just an update on that I'm very happy that I'm sticking to the Code of Conduct. There's parts in there that are around transparency with the public and being as open and honest about our decisions and actions as possible, and also maintaining and strengthening the public's interest and confidence in our integrity. So which is why it's important, I feel, that we have these discussions in the public domain as well as the private. Anyway, to get on to my points. So I've already expressed concerns from a clinical point of view. Many of our clinicians have about the impact that this will have on our people. I'm particularly talking about the 7 proposals that have gone out to consultation. There is no doubt, and one of our clinicians has said, that these proposals, if enacted, will cause harm. There is vulnerable people who are going to miss out on services and equipment that are vital to them living healthier lives. Another example is waiting lists, which some of our fantastic teams have worked really hard to bring down a certain waiting list, which was almost a year long, if not more, down to 2 weeks. Enacting some of these proposals will instantly put that waiting list back up to a year, which not only has an impact on the service users that need to access that service, but demoralising the staff, really, that have worked so hard to just in the click of a fingers take that away. And I know nobody takes these decisions lightly, but I feel that that's the importance of that is in looking at alternatives. Some of the proposals also, our staff side colleagues have informed us that some of them cannot be enacted due to excuse me, cannot be enacted due to what is written in staff contracts. So weekend working, for instance, cannot be taken away from staff. That was good knowledge to have, and I think it shows us maybe learning for the future about consultation with professionals before we send these proposals out to consultation. I think that's really important, and that's some of the feedback that we've had this year very strongly that we really need to take forward. However, I do think that there's still ways forward from this position. Like I say, I was pleased to hear the comments from Jane and Dave there, and also Christine, that there may be further funding coming in. That's fantastic. I think that for me, the real focus on service redesign and organisational redesign is the only way forward to deliver financial savings with the sustained impact that we want, so that we're not finding ourselves in the same position every April when it comes around. I did have a question around our reserves that we have. So I see that after we've approved our last decision on the stock controllers, there should still be, according to my mathematics, £625,000 left within the transformation fund. My question with that is, could we put that towards some kind of organisational redesign and efficiencies that could help us in the budget this year, even if it takes longer to implement? And I noticed that there is also still over £1 million of ring-fenced reserve funding, which is for strategic developments. And could that be applied also in a similar situation? Thank you.
I think Dave and Christian would probably like to step in on that.
So, thanks for take your comments on board around the sort of clinical perspective and also the staff side perspective. I think that's the key element for us around. We are in that consultation period just now anyway, and these are the sort of elements that we need to be taken into consideration, in addition to obviously taking a wider view. So some of us have already been involved in public consultation exercise and discussions. So we've heard from individuals who may be affected by some of the potential savings here. So again, quite sobering in terms of impact on individuals. And we've also heard from providers, care providers, because obviously the biggest saving that's in there is around our providers and our social care providers, and the impact that might have on them, and also their service users. And we've also this week also had a workforce engagement session as well. So again, we've heard from individual staff members around concerns, but these kind of sessions are replicated over the next couple of weeks, so we hear more and more of these voices as well. So it's particularly to kind of get all that information in terms of the risk, so whether it's around clinical risk for particular services, and whether it's about kind of staff side and workforce issues, and also from service users and the public. And I think so. I know you could picked up on the things like that. From the staff side of things that saving around weekend working, for instance, could be enacted. Well, I suppose that there's an issue around, well, it could be enacted, it's just the timing of when it could be, because obviously the staff turned over, etc., as people can move on, and that could still be. I'm arguing if we say, well, that's not going to happen anymore, and over time that would start to kind of go, but except that it's maybe not an instant kind of saving around that. So yeah, what did we get all the news now? And then, as we kind of said previously, at the meeting on the 11th of March, consultation will have concluded. We'll have the feedback from our individual sessions and individual conversations that been having as well, and that's from clinicians or other professionals around that. So yeah, I'll stop at that point. Also, just the reserves.
Yeah, no, I was also just going to add in as well, in terms of the closing the gap to 12.6 million, just under 5 million of it we are looking at through operational efficiencies and management actions in terms of trying to do this, which have been assessed as having no or minimal impact in terms of operational service delivery capacity. So this where we can, and in terms of the proposals that come forward, looking at things that have that don't have that impact, that risk impacts that across the whole system, and trying to minimise that and manage this as best as possible and take these proposals forward. But given the scale of the challenge that we have, we've had to look at all options and all opportunities across the entirety of all the service delivery that we have. So as I said, these are proposals that have come from individual services. As saying these could be done, but absolutely they will have some kind of impact. And we are through this consultation and the conversations is that gathering that intelligence in terms of understanding what that impact will be. To then determine if we continue to take these proposals forward, and if we actually present these to you along with the feedback and information to allow that informed decision to be made, and in terms of recognising that we have a restricted financial package in terms of what we can do, and we need to be living within those means. So in terms of the reserves element, yes, we still have an element of transformation funding. That absolutely becomes an option. We do have a number of project management staff and officers across the organisation. So we're very considering if there's lessons learned from individual projects that we can look at collectively and utilising some of the skills and the expertise of that. And that if that requires additional resource, then we will come back to the IJB to ask for release of transformation funding to support that going forward. That's obviously not going to be in place and available to us in terms of delivering the budget position for 26-27. But as a management team, we're already started the process in terms of as early as possible for future years, as well as that includes that conversation. So that we really trying to get ahead of the position for future years. This is not going to get any easier, but next year is a really challenging position in terms of the scale that we're looking at. And the ring fence funding in the reserves, this is funding from Scottish Government for particular initiatives and particular projects. So the only way that we could be looking at redirecting some of that would be to go back to Scottish Government and ask for permission to take something that they have given us for a specific item or project and ask for that to be diverted to something else. I would say that the only reason we've actually got this, the funding in reserves, is because the funding's come through and it's been sort of timing slippage, so it's not that we've got underspends as such on this, it's more timing slippage that the funding has come through in one particular year, but due to timescales of actually delivering things, and that's what we're not started until later in the financial year and taking a bit of time to build up, so it's it just means that we can continue something for the amount that we've been initially anticipated rather than having an underspend. So, yeah, and there's probably not something that we can necessarily rely on without that formal approval from Scottish Government about funding.
Dave's working.
Can I? Oh, sorry, Dave. Sorry, I was just going to ask, so if that strategic development funding wouldn't be appropriate for this kind of spend, then what exactly is it for?
So the bulk of it, I think, is the primary care aspect, and it's linked through sort of drug. It's the drug redesign programme, and that's developing in terms of shared care with our primary care, and so that's a significant portion.
Okay, that's great. Thank you.
Yeah, just to come in, because I think as it were to get consider the totality of all the transformation funding, because both our partner organisations funding side. So while we look at things like kind of wider service redesign, we're looking at that needs to be taken into context of the whole system kind of redesign. So if there's transformation funding from an NHS side perspective, then how do we kind of best kind of access that and utilise that across the system? So it goes back to that kind of earlier point around how we're kind of more and more working across the side as the three integration joint, kind of three health and social care partnerships. And obviously there's the more specific around Dundee City Council, kind of the funding around that. So we'll continue to look at the opportunities that exist across the piece. I think there will be a connection that we'll need to kind of put to you, depending on where we are with it. It takes a while to convert it. There is still a residual transformation fund left, which would be describe the rest of the reserves are already committed and not necessarily things that we have control over. Then it does take the balance of that transformation reserve and go towards our bottom line. Just this is might be something you need to consider, because that balance is not legally committed, so it needs to be on the table if you like. But what it means is it restricts what we can potentially do. So obviously the day a small amount of investment that can deliver a kind of savings. So again, that will be a decision that we'll need to kind of come to as an IJB at the end of March. So that helps.
A number of hands up here. I've got 5 more, first of which is Christina Cooper from TPVA. Or representing the first thing, there you are, Christina. I don't know if you're speaking, Christina, but it's struggle with a good. Still one bit. Perhaps we could move on. I'll take Dorothy and I'll try you again after Dorothy. Christina, yeah, Dorothy.
Okay, couple of things. I was interested to hear that phrase that you used, Christine, minimal impact, in terms of operational efficiencies. I would challenge that, because those operational efficiencies will include, we overspent on our home care packages, social care packages last year, and we've got to claw that money back. So there won't seem to be so much money available for home care packages. My view on that is that older people will then languish in hospital waiting for a home care package to so that they can be cared for at home. So I think that's a real harm and not a minimal impact. So the operational efficiencies in this proposal amount to something like £5 million. And Colin spoke earlier about transparency, and I've made this point last year as well. We're consulting on the new proposals, which come to about 4 million. That's what the consultation's gone out about, hasn't it? And we're not consulting about operational efficiencies. Now, I understand why that should be, but I don't think that's a very transparent way. I don't think that makes it very clear to our service users about the implications of the 12.5 or the 13.5 million that we're having to cut from this budget. The other point I wanted to make was that managers have been asked, you know, what are the implications of a 5% reduction in funding, or a 10% reduction in funding? What are the impacts of that? Look, where will we see this? Will this be incorporated? These managers' views, will these be incorporated into the impact assessment that comes once the consultation is over? So that will include these managers' views as well, Catherine.
Yeah, and some managers may also respond to the consultation, so we're very open about the workforce, and there's no issue with our managers responding to that as a member of the workforce as well. So they might formalise their views through the consultation process as well as what they've given us through earlier processes too. So we encourage managers to do that and not to feel that there'll be any issue with that in terms of their opportunity to have their say from a professional point of view, because many of them hold professional and managerial. So it's important that they know that they have the ability to do that too.
We will hear what is saying about that. The last point I wanted to make was about options. And already I've seen, I think, if the board can have their options laid out. Colin spoke about the code of conduct, and we have a code of conduct as well. So we need legal advice and financial advice about what are our options, what is possible at the end of the day. Because I feel myself being pressured into accepting a budget which includes £13.6 million in cuts without any other option, but I would like to explore what the other options are. And I would be grateful if we could arrange something like that with legal advice and financial advice as to, because Ken already called it the nuclear option, right? We don't want to go down that path particularly, but I'd like to know all of the options that I've got.
I know that Roger offered the opportunity on a one-to-one basis to speak to him about this. That's yeah, Dave, do you want to?
Yeah, that's not in, I'll pick up that particular point. So yeah, following that last development session, Roger, myself and Christine, planning to get together to confirm exactly where we're at, and then have a separate session as a collective with the members, with voting members around those options, and what we do.
That's all together.
Yeah. Well, that's good. So that'll be a further session other than the budget session we have.
So we'll have this, the budget development session, the final budget development session we can planned, and will be focused on the feedback from the consultation, update from Christine in terms of the financial position post council budget setting, and also NHSP set applications. So clear picture there in terms of March, that will maybe give further options as well in terms of our the savings list that we've got. But we'll also have something separate because of the long session. I might just be very the responsibilities options from March.
So we can do that all in one session, but we did.
If we can do it, I would say
that way sort extra. I'd like to step three.
I'm suggesting we've got quite a lot to consider in the next development session. So maybe some.
Okay. So next, I'll try and bring Christina Cooper in again if she's able to now
Hi, Ken, can you hear me? Right, thank you. Again, it's in relation to the impact assessment, and I am very much aware we're still out for consultation and there's some assumptions here. And this is going to affect, you know, I'm here to represent the third sector, but it's going to represent, you know, all sectors as well. But, you know, I think the devil is probably in that detail of the impact assessment needs to be quite thorough, because 10% to one charity or one third sector organisation can mean £2,000, and 10% to another could be quite significant, and that £2,000 could be. And I think in addition to this, we need to consider that the third sector has not had a cost of living increase for significant amount of years. Some of contracts that I'm looking at is over 10 years, or it's been a minimal 1%. So really, in real terms, they've had cuts anyway, which are quite significant, without a full thorough review of their service level agreements, and quite often are expected to deliver the same level of service. So I think as part of this and learning moving forward, we need to be looking at the timelines of reviewing commission services in line with this impact assessment, because it is going to be significant for all of us, and it's going to hit the most vulnerable people that we've got. So I know I've spoke to Dave and others, and that the consultation feedback will be really, really useful with us. But again, time is not on our hands. When we're talking about the end of March, you're talking about staff, people's livelihoods, and some sectors having to close down, you know, hubs, etc. within the city. So I think planning ahead has to be vital as an integrated joint board, and somebody did mention the voting rights moving forward, and I'm glad that that will be coming as well for the third sector carers and that users' voice as well. But yeah, without having to repeat too much, this is going to be quite significant, but we also need to see it as an opportunity to learn that we're not in the same position year on year. But I'm very much considerate that this isn't a blame thing. This, you know, it happens, and I'm very much aware of the budget timelines don't align either. So, but it would be amiss of me not to highlight the impact that this is going to have on the third sector within the city.
Thank you, Christina. David?
Yeah, it's interesting listening to people's contributions and all of this, and the cumulative impact of that's probably affecting what I'm saying now. Because I covered a fair bit of that, but I you know, the words, you know, when we talk about minimal impact here, I think somebody else mentioned, Dorothy mentioned this, I think, as well. I don't doubt the challenge here, but I am concerned about impact, and the fact that we've gone to consultation. I think there's a kind of common agreement between board members and contributors that what we've put to consultation effective is just a list of the intended changes. We are really concerned about, you know, the fact we're looking at 4.85 million of operational efficiencies, and nobody's being alerted to what they are out there and what the actual impact of these will be. Now, what comes back? So I think that's an error in the approach and all of that. On the consultation response, what's going to be the reporting? I'd like to know what the reporting on that's going to be, because I get the fact that we're a month late because of Scottish Government here, but reporting. But if what the results of that consultation that come back, are we seriously going to have time to change our proposals on the back of that? Is one thing, because I do have concerns here about something that was brought up in the development session about equality, and that vulnerable people perhaps could be overly, what's the right word here, overly proportionately affected by some of these changes. And I think I'm looking back at the paper here in 4.71 and talking about service leaders here being asked to contribute their thoughts on a 5% reduction or a 10% reduction, and then we're coming in with the full part year and full year benefits from that. That doesn't tell me if that's a 5% or a 10%, but I just feel we haven't been got any options in it. We haven't been given options on all this like we had in the previous year. And to get round the equality issue that I'm concerned with, and there not being a challenge to that on the basis I've just said is, we don't like the idea of what people say salami slicing at 5% off, etc., across all services. That would have been one way of maybe getting around the equality side of it, because then all services might have suffered from it all. In summary, I'm just not happy here about what we're being presented with, and that we're not, as board director, and as Dorothy has almost said, being pressured into accepting a list of proposals that have been just put to us. There's not options for us to choose from. So I'm not happy with that. I am pleased to hear about a session on the responsibilities of the board, and looking at the Public Bodies Joint Working Scotland Act 2014 and about the responsibilities. And there is a responsibility in that to deliver a balanced budget, but that's as a board. So I'm really interested to hear what's going to be brought out of that session, because I, for one, will not accept being told on budget day of the consequences of not agreeing a balanced budget. That should be known already, and I can't believe it's not, and why there's a reticence to publicly advise the board of the specific implications of doing that. On budget day, IJB members can obviously, if they're not happy with the budget and it's being forced, then IJB members can dissent on that budget and record the dissent publicly on the budget. You can probably tell my sort of sense of dissatisfaction here. And I would say, again, I know you're trying there in the room, but the sound quality again is very poor in hearing exactly what people are saying. So I think come budget day, I'd recommend that everybody attends the meeting in person, so we can get clear discussion on all of this, because if I'm not hearing things properly, I don't believe everybody else is either. That's just a final point on all that. I'm covering a lot in there, I know, and a lot of it will be comment rather than question, but hopefully we can maybe pull something out of that. Thank you.
Yeah, no, that's David. So it's quite a few things in there. So I think from my perspective, so we've got the 31st of March, so there are choices, because the choices will be if you as the IJB do not support the options that are kind of laid to the table, then you do not support them. And that's what we're kind of working our way through, except your comments around not knowing yet at this stage what that might look like. And that's what the kind of conversation with myself, Christine and Roger is about. As we said previously, it's not as uncharted territory comes to be in here. It probably is a bit of a miss that it's not been in. It's not reflected in either the integration scheme itself or standing orders. And that's something that we need to kind of reflect on and see whether there are other integration schemes or standing orders around the kind of country that actually kind of set that out quite clearly in terms of what happens there. Because as I said previously, we know that not every IJB has set the budget within that sort of timescale, and that would include then that whole issue about the kind of being clear on responsibilities and roles. So if there is a case on we get to 31st of March and following the feedback from the impact from the consultation, the impact assessment, you as members do not want to support the kind of budget, then that's something that we need to take into. It will not happen on the 31st of March. We'll need to get it and move us into the new year. All we're saying around that is that there will then be kind of consequences and restrictions placed on the IJB in terms of law and commission until we get to a position where we actually set a balanced budget. The position set out today, and as we're going to set within the development sessions, are as we understand the financial position to be. As I said, we've got a council budget meeting on the 5th of March. And if there's additional funding comes through that, then that will obviously kind of provide more of an option from an IJB perspective around the kind of savings themselves, depending on the value that might be. And similarly, from an NHSP side perspective, if there is a desire and a move to kind of shift resources into the IJB, then again, that will also kind of impact positively on our financial position, and then would require less of a savings, and then provide sort of potentially some more kind of flexibility and movement in that. So I appreciate that as things stand at the moment, as an IJB, we feel like there are no options because you've got to take everything on the table, plus there's still a gap. But until we can get that confirmation from our partner bodies, that's all we can bring to you at this stage. I can't promise that there's other funding that will be included within that. So I probably haven't answered half your questions in Florence there, David, but sorry, Catherine's wanted to comment as well.
Sorry, just to add to that, where you started, David, in terms of the reports, the report will be in the same format that it was last year in terms of the consultation. That report format in terms of the findings, I think was well received by the board, but also served the purpose of being transparent with the public about reflecting back what they had said, so it still needs to be a publicly accessible report. I just thought it was worth remembering that actually last year it did have an impact on what we took forward. There was one proposal that was removed. There was others that were affected in some way, to some degree, and at least one where, in particular in third sector, reductions and targeted reductions where it had a substantial impact. Although the proposal went forward, it went forward in a different format as well. So our turnaround last year was tighter than it is this year as well. So I just think it's worth noting that it did actually substantially impact what was proposed to the IJB last year, as well as then impacting significantly the integrated impact assessments. And if we can manage that last year, and I think we had about 5 days last year to turn it around, we've got longer this time to be able to do that. So just that was worth.
I really think of the level of discussion we've got on today, we need to make sure we have enough time for this, what's effectively a pre-budget meeting. I'm informal, but I think we need to make sure we have enough time for it.
Yeah, Chris, Ken, I get that, but this is really serious stuff, and it's. I know this support is for noting, but we're limited to really realistically now about 6 weeks, and I appreciate there's moving targets here, as Christina said, and I was going to suggest that as members we need to be kept informed of all of these as appropriate, right the way up to budget day. So whether that's by an email to us telling us for weekly changes or whatever, these are really important. We just can't note this report and blankly and then wait until the next thing happens. We need to actually be on the front foot on all of this. And Catherine, just what you were just saying just now, I accept what you said about last year, but if there had been a list of options for us here to actually consider, then we'd be saying, well, the impact of that change in result of the consultation gives us more onus on looking at this option that we could look at as well, but we don't seem to have that. It's just a list of this is the same as we plan to make, but there's not other ones saying, but we could do this instead of that, or here's a list of 20 options, and we have to choose whatever. So many of them that will add up to 12.6 million, but we haven't got that. We've got numbers that add up to that 12.6 million. Okay, I think I probably said enough on it, bearing in mind this is a paper, but I'm just trying to get across the urgency of updates on this between now and the 31st of March, rather than just waiting to be given a fait accompli at the end of it all.
Yeah, that's David. I think taking your point on board there about being kind of more informed, I'm quite happy for us to provide email updates before the 11th. As you said, the council budget's on the 5th, so that'll kind of give some clarity on the council, well, it'll give us a definitive on the council's design, not clarity. So we'll know at that point if there's any additional funding coming through to kind of offset that balance. Happy to kind of share with IJB members at that point the outcome of that budget and stuff. And similarly, once we get confirmation in writing about the additional funding that was referred to earlier on the living wage, for instance, again, we can feed that in so you can see. So it was £12.6 million. It's now this million in this this balance, and then what that would kind of mean for any sort of kind of savings that will be required. So I'm happy to do that. We had kind of originally intended that the 11th of March would be the date that we would kind of do that on and kind of gather it all together. But if members are given the feelings of the members have just now, particularly the transparency, kind of happy to share what we can as it comes in and as we acquire ourselves around it. Do that via email.
Yeah, thank you. Okay.
Okay, I have 3 more before I think we conclude today. Next up is Raymond.
Yeah, thanks, Ken. Apologies, I got kicked out and I missed some of the start of this item. I got some of Dave's responses, I think. So I'm not really asking a question, it's just to make the same points that I made before, which was around these savings or suggested savings around. So the concern around the risk of deliverables, and I think it was touched on, given that staff's terms and conditions, you may not be able to deliver in year. And that's the detail that I think is missing for individuals. I think their comment was around the consequences of these as well, and I think that's more within the third sector proposals, the third sector proposals, and the reduction in delivering of some HB services. What does that mean? And that's, I think that's the detail that David's probably asking about. So therefore, you could ask for options to say, well, what if you did this? If you did this, so I was really just to say, I appreciate we've got the meeting on the 11th that we'll be able to then ask further questions, hopefully be some detail. But I've really got concerns about the deliverables, and I've got to agree with David. I think this is a very, very important discussion. I'm struggling to hear sometimes on this call. So I think it would be better if we made the effort to get in the room, and I'll certainly do that. But that was only comments, Chair, rather than a question, because I think we've got opportunities to have further conversations around this. Thanks.
Yeah, I think one time I attended virtually, I found it difficult. So I think that's one of the briefing sessions rather than the full meeting. But yeah, I found it difficult to hear what was actually going on in the room, so it's problematic. I have Bob next, please.
Thanks very much. Indeed, gosh, much of what I might have wanted to say has already been said, and I think it is what this comes back down to is the fact is that all IJVs across Scotland are really struggling with the financial statements that have been made so far. So it's a no-win situation for anyone here. I think the impact assessments are absolutely critical to this for gaining public support and awareness of what's likely to happen as well, should any detriment to current services happen. I think for me now, I don't think we can resolve these issues within the current IJV arrangements, and I think we need to look much more radically when we come to reviewing the current integration schemes come later on this year, which we will have to now, because I think there are other changes that are going to happen, and of course we've already alluded to different voting rights, etc. So I'm optimistic as well as sort of a better way forward on this. I do think I was quite critical of the narrative that went out with the public consultation on the Kirky 5 million. I thought it was poor, and I didn't think it demonstrated enough mitigations of what we tried to do already within that. But I think the other gap around the 7 million Kirky is one that we really need to look at, and because that's where we can be a bit more radical, I think. But that needs a whole lot of joined up working across all of the funders as well. So that's currently where I am with it. Thank you.
Thank you. Well,
Thank you, Chair. It's obviously really, really complex, and just need to get a handle on how this works. So please forgive me. The council set its budget, and money comes to the IJB.
well, yeah.
NHS budget is after the start of the year. From the point of view of, I think it's been ascertained that there may be things that come in which are not expected at the moment. If there was additional money came from the NHS or the council, would that come with caveats? So for example, if the NHS said, well, food train, that would mean that we would have a strain on the dietitians. Therefore, we want to keep food train there. Is that something that they can dictate? And it's very obvious around here that we've got someone who is representing the IJB and the Health and Social Care Partnership, but who's in the NHS deciding how that budget is brought together? Is it the board members or is it the financial person? Because again, sorry, excuse my naivety.
Yeah, so in terms of the NHS board and the council once decide how much money they wish to transfer into the integration joint board for us to deliver on the strategic plan that they agreed and that they agreed as well. So so if there is additional funding, there could be caveats attached to that. So it could be, for instance, it's around, we'll give you money, but you need to invest that in social care, or you need to invest it in something else. So we would need to be kind of looking at that as it came in with those caveats to say, so what does that deliver? What does that mean for our services? Given the kind of gap that we've got, I would hope that there's not anything that comes in and you need to provide something additional, because that doesn't help. Because if we're struggling to kind of maintain the service levels and do it, to then be asked to do something above that, is kind of productive around that. So for both the local authority and the NHS board, there will be kind of decisions. The governance will sit within the kind of that senior level in terms of board or quality, and the advisors will kind of get, so whether it's the council, but perhaps the NHS, that's fast chief execs, myself in terms of my particular role, so obviously I'm going to advise both the local authority and the health board on implications of our budget and potential mitigations around that. So, it's not one person decides how much money goes in, and it also will tie in with, should tie in with the strategic priorities. So what are the strategic priorities of both the local authority and NHS board? Probably what's going to probably more kind of prominent is the impact on NHS side of decisions that we make here and vice versa. So if we reduce the infrastructure, that's obviously what some kind of been fed back, particularly in some of the clinical risks around that. So what does that mean in terms of where to kind of reduce our care at home and reduce our local organisations and funding? And what does that mean for harm and then people ending up in acute hospital settings kind of quicker than they would have done either or we can't get them back in because we want to do. So there is very complex. People need to be looking across the whole element, not just the one bit. The problem we've got is that because our funding comes from the two parts, we don't have the opportunity to raise income ourselves. It's a case of if that's the problem we're given, we need to get we can find out what this we can provide, which is where we're at these difficult decisions.
Yeah, and I think the thing that threw me was earlier when Raymond was asking about the test of change, and effectively, if I got it right, if NHS have said, no, you can't piggyback onto our, you can piggyback onto our learning, but you've got to pony up the 80,000, and that doesn't seem like it's a mutually sort of agreeable.
Integrated.
Yes, that's the word. So that's where I'm kind of wondering, obviously we've got to be the three, the advocates for the whole. Is that right? I'm thinking. So they're not in the room at the moment, but presumably Bob and David and Colleen are speaking to the board at the NHS to say, look, this is really radical and we need nuclear, and we need you guys to make sure you're bringing it to the table as well. Is that right?
Yeah, okay. The board, full board, the NHS side just to formally approve their budget, doesn't it?
Yeah.
Just to agree, although there's a lot more rough and tumble at the council budget setting meeting, I'm sure if we were all members of political parties, and
elected.
Yes.
Okay, all right, thanks, that helps me get a bit clearer. So that's your job, guys. Be feisty.
Could I just ask, if we're going to have then a session on options, to explore our options as a board, and we've got one more budget development session, do we?
So what we'll do is we'll have the 11th of March, which is the planned budget development session, where we'll go through the outcome of the consultation, and we'll also kind of confining anything else. So basically, they'll make the kind of most final financial position that we've got for next year to see. So, and at that point, we'll then be able to start to explore. So, what are the options within that in terms of?
That'll be combined of the 11th. We're not having a second.
But what we're looking at would be a separate session around which we're probably going to focus more on kind of process and what happens if we don't agree a budget, and then that whole thing around the pressure that you feel to make a decision and kind of just explore that further in terms of, so if we don't agree on the 31st of March, what does that give us?
Yeah, okay. So we need to know what the consequences are.
Yeah.
Whatever we decide.
Yeah.
So I'm going to close that item, which was on voting.
So that then takes us on to item 12, which is the IJB attendances, which is submitted for information. Item 13, which is the development sessions. Again, you also note that there's a joint development session being arranged for the 13th of March between 10:30 and 12:30. That's about mental health.
Yes, so that's been hosted by.
And the last item was the date of the next meeting, which is Tuesday, the 31st of March at 10 AM.
And I would point out for those that are attending in person, it's in committee room 1, which is larger than this, so there'll be enough room for everybody, which is if you want to attend in person, but not space, and there certainly will be. Thanks everyone for your attendance today. It's been here. Hopefully everyone will be working for our next development.
Okay, thank you very much.
Thanks, everyone. Bye.
Thank you. Bye bye.